In this video, we will be discussing about the sensory supply of the face. Sensory supply of the face comes from the trigeminal nerve and its branches and from the upper cervical spinal nerves. So we'll be discussing which branch of the which nerve is supplying which area. So first we will be dealing with the V1, that is first division of the trigeminal nerve, ophthalmic nerve. Ophthalmic nerves gives branches, that is ophthalmic nerve has three main branches: frontal, nasociliary and lacrimal. And from the frontal nerve we have a branch supraorbital and supratrochlear. See, frontal nerve is given here and it gives two branches, supraorbital and supratrochlear, as marked by these arrows. Then lacrimal. Lacrimal will be supplying separately. It does not give any branch, and lacrimal will be supplying in the region of lacrimal gland. Then nasociliary. Nasociliary branches are marked by green. It gives posterior ethmoidal and anterior ethmoidal branch. And then infratrochlear. Infratrochlear comes from the nasociliary and external nasal. External nasal branch comes from anterior ethmoidal nerve. Now we'll be seeing in the main diagram. See, in this diagram, supratrochlear and supraorbital were coming from the frontal branch. So they are supplying which area? Supraorbital, supratrochlear. Supratrochlear is lying medially, so it will be supplying medial superior eyelid and anteromedial forehead. Then supraorbital. Supraorbital is lying lateral, so it will be supplying anterolateral part of forehead and scalp and frontal sinus and upper eyelid. Then we have the lacrimal branch. Lacrimal branch is direct branch from ophthalmic and it will be innervating the lateral part of superior eyelid and the lacrimal gland. As lacrimal gland we know lies in the lateral part. Then is infratrochlear. Infratrochlear is a branch of nasociliary and it will be supplying lateral to the nose, medial most part of the eyelid, lacrimal sac. Lacrimal sac we know lies medially. So lacrimal sac and lacrimal caruncle will be supplied by infratrochlear. Then we have external nasal branch. External nasal branch is a branch of anterior ethmoidal, which is further branch of nasociliary, and it innervates the skin of the nose. So we are done with the five branches that supply in the region of ophthalmic nerve. Then we have maxillary nerve. Maxillary nerve gives three branches. Both maxillary and mandibular division will be giving three branches. So maxillary first is infraorbital. Infratrochlear was in the ophthalmic region only. Infraorbital is by the maxillary nerve and it innervates the maxillary sinus, maxillary teeth, inferior eyelid, skin of the cheek, lateral nose, nasal septum, and upper lip. All the things lie in this region. It will be innervated by maxillary nerve. Then we have zygomaticofacial and zygomaticotemporal. Zygomaticofacial and temporal both are the branches of the zygomatic nerve. Zygomaticofacial innervates the skin on the cheek and zygomaticotemporal innervates skin on the temple. Then we have mandibular nerve. The three branches of mental nerve in the region of chin and it is coming from inferior alveolar nerve. From the inferior alveolar nerve and will be innervating the chin and the inside of lower lip. Then we have buccal nerve. Buccal nerve is innervating skin and mucosa of the cheek and part of gums. Then auriculotemporal. Auriculotemporal will be innervating posterior part of the temporal. Auriculotemporal, basically remember that it is lying between the temple and the auricle. Auriculotemporal, and it will be innervating the skin in posterior part of temporal region, the skin of the auricle. Then inside the auricle we have external acoustic meatus and inside that we have external surface of tympanic membrane. So all the external things related to the ear will be innervated by auriculotemporal nerve. So once again we revise the branches in the brief: supratrochlear, supraorbital, lacrimal, infratrochlear, external nasal. Then is infraorbital, then zygomaticofacial, zygomaticotemporal, mental, buccal, and auriculotemporal. And next we have branches from the upper cervical spinal nerve. The most important and the most frequently asked question is regarding what is the nerve supply of the shaving angle or the angle of the mandible. It is supplied by the greater auricular nerve. The question can be regarding the angle of the mandible, the parotid gland, or the earlobe. All the three structures in this region are supplied by the greater auricular nerve, and its nerve root is C2 C3. Then we have another image which will be showing other upper cervical spinal nerve. This region was supplied by greater auricular. Okay, then we have the lesser occipital nerve, greater occipital nerve, and third occipital nerve. First, we discuss the lesser occipital. In the lesser occipital, we have root value of C2, C3, and it will be innervating the scalp behind the ear. Then we have greater occipital. Greater occipital will be innervating the occipital area scalp, and it is C2. Then C3 region, we have third occipital nerve, and it innervates the scalp in occipital and suboccipital areas. So let's again revise the upper cervical spinal nerves: greater auricular, then is lesser occipital, greater occipital, greater, lesser, less, greater. Then is third occipital. So that was all regarding the nerve sensory supply of the face. Thank you.